Welcome to AFDTV. I'm Dr. Steve Samadrala, and I'm here with well-known neurosurgeon Dr. Sana Dixit, and also our guest star, Bree. So today we're going to talk about Bree's story. So take it away, Dr. Dixit.
Bree, we had a chance to talk about this earlier briefly, but why don't you tell me again what you were sharing with me before.
Well, years ago, I experienced a fainting spell, and in investigating the cause of the fainting spell, I had an MRA, and the MRA showed that I had a small lump on my brain, and so the surgeons figured it may be an aneurysm. So in investigating further, they recommended an angiogram.
Right.
On the day of my angiogram, I had a panic attack, and the surgeon at that point recommended, because of the size of the lump that they saw on the MRI, that it was so small that they would just recommend not doing the angiogram that day, but having another MRA in 6 months and continuing to monitor it with MRAs to make sure it didn't grow. And if it grew, then they would do an angiogram and go from there. But this has been years ago, so I was just wondering if I should continue to have the MRAs or what your recommendations are.
Well, before we answer that question, if you don't mind for the audience, let everyone know what an MRI is.
Sure. So an MRA is a non-invasive way of studying the blood vessels using an MRI magnet. It's specifically designed to look at the arteries and the veins.
And how many MRAs have you had?
Maybe 4?
4.
Okay. Now you're pretty young to have the diagnosis of an aneurysm. You're pretty young to have had that many MRAs. I understand why you were anxious about the diagnosis. I also understand why you were anxious about the finding of an aneurysm. Just for the viewers who aren't aware, an aneurysm is a weak spot on the artery. If it bleeds, it can be a life-threatening problem, can cause some pretty significant issues. And we have a model of a brain over here showing basically what some of the arteries look like. Very, very tiny structures. It's not always very easy to see on a scan like an MRA. So I understand why they made the recommendations that they made for you. For where you are right now, Bree, I think the best thing is to get some updated information. Another MRA would probably be where I would start. If there was some abnormality on there that was questionable, I wouldn't hesitate to get an angiogram on you, if for no other reason than to prove that there's not anything there, so you can at least put that issue to rest.
Okay. Thank you, Dr. Dixit.
Sure.
That's helpful.
And as far as to alleviate anxiety in case you were to get an angiogram, so what are the biggest risks for angiograms?
The biggest risks with an angiogram are bleeding down by where the puncture is made. It's like a heart catheterization, so there's a small risk of bleeding, bruising, infection, blood vessel injury. The biggest thing we worry about is the risk of a stroke. In an experienced practitioner's hand, that risk is pretty darn close to zero. You usually run through the risks over a few minutes with most patients, but the vast majority of times it ends up not being that much of an issue.
Sure. And that's where there's a lot of fancy words that we talked about today. And the partnership between a primary care physician or patient and neurosurgeon, really it goes a long way. And also involving as many family members as possible, because quite often you may hear something, that you don't remember. So and then, of course, Google. Google, I mean, you don't want to get too afraid on what you read on Google, but at the same point in time, I do recommend for patients to do their research ahead of time, so when they go, they can ask questions. And I love educated patients. I love answering questions. And of course, I'm sure for you too.
Absolutely.
Yes. So, well, thank you for watching AFDTV. More coming soon with Dr. Dixit.
The preceding advice provided in this video is informational and strictly the opinions of Dr. Samadrala and AFD Clinics. For a more accurate medical opinion of your personal health, please consult your primary care physician or visit one of AFD's clinics today.